Every 40 seconds, someone in the U.S. has a heart attack. That's about 800,000 every year. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker tells us about the signs of a widowmaker heart attack and what surgeons do to keep a heart attack patient alive.
The heart attacks that are most concerning, the kinds that cause large amount of damage to the heart muscle, colloquially we call it the widowmaker, which is the proximal left anterior descending artery.
Dr. Anand Prasad, the director of the Cardiac Catheterization Laboratory at University Hospital within University Health System, says widowmaker heart attacks are often deadly.
When that artery is blocked, it can lead to a large amount of muscle death and increases the chances that a patient might actually expire from their heart attack.
What you are seeing here is the left anterior descending artery, which is completely blocked. In cases like these, surgeons put a balloon and a stent in the artery and expand that balloon, which opens the artery, pushing the clotting blood blockage out, restoring blood flow. And the faster this is done, the better the outcome for the patient. Some common symptoms of a heart attack include chest discomfort or pain, upper body and stomach pain, shortness of breath and lightheadedness, sweating and nausea, and especially in women, pain in the back, neck, or jaw. Dr. Prasad says when you see these signs, act quickly.
The longer that goes by with lack of blood flow to the heart, the more damage that occurs.
And because family history is a major risk factor when it comes to heart disease, education is key.
If a family member has had a heart attack, they should reach out to their siblings, to their parents, to their children, educate those around them about heart disease.
In next week's Wear the Gown, we'll introduce you to a man who suffered a widowmaker heart attack and hear how the lightning-fast actions of those at University Hospital saved his life. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can find all of the rest of the Wear the Gown stories at wearthegown.com.